Good afternoon. I'm George Latimer, Westchester County Executive. It's 2 o'clock, and this is our update on the coronavirus outbreak here in Westchester County. It's Monday, the 11th of May, and we have continuing encouraging news from our statistics that tell us that the extent of the contagion in Westchester County is dropping. And our numbers as of today show that there are 31,384 total cases of COVID County. That's up 90 cases from yesterday. But in terms of the number of active cases, the active cases have dropped by almost 300 cases. We now have 3,377 active cases. And as I explain each day, the active cases are the total number of positives as of today, subtracting those that were positive 2 weeks ago today. That is the period of incubation. So at 3,377 active cases of COVID in Westchester County, we're down dramatically from our peak, which was 11,000 cases about a month ago. And that is a good sign. We don't have most recent hospitalization numbers, but we do know that hospitalizations are under 500 now across Westchester County. That is down from a peak of a month ago of about 1,200 hospitalizations to COVID, and shows plenty of bed capacity within our inventory of available hospital rooms and also available ICU rooms. The number of deaths that we have increased to 1,227. We lost 9 individuals overnight. And of course, every death is a tragedy, and it's very difficult to accept for the family who have lost a loved one. With 9 people passing away, this is a continual drop in the nightly overnight fatality numbers. And that has also been a consistent reduction over the course of the last month, with 1 or 2 spikes that have changed it. Our numbers now are well behind the larger counties than we are, Nassau, Suffolk, and the city of New York. And we're showing some very positive signs in the right direction, which is why so much of the conversation has led to a discussion about how do we begin the process of reopening Westchester County from this shutdown we've experienced now for 2 months. We have tested 112,663 individuals, and that represents 11% of our population, 11% of the total population of Westchester County. As I say each day, that is a higher percentage than in any other jurisdiction in New York State, and most likely higher than any jurisdiction in our basic area outside of the state. 72% of the people now being tested every day test negative for the coronavirus, and that also is a good sign. That does mean, however, that there are 28% of the people tested that do have the virus, and that is still a concern. When we look at the major communities of Westchester County, the city of Yonkers, which has a quarter of the population of Westchester County, has 6,484 people that have tested positive for coronavirus. But at the present time, there's 622 active cases in Yonkers. 622. That is the operative number of people that have tested positive and have not cleared the 2-week protocol for coronavirus. In New Rochelle, the number of active cases is 233. In Mount Vernon, 228. In Greenburgh, Villages and Town, 227. In White Plains, 204. And the total number of positives are much higher numbers. In New Rochelle, 2745. In Mount Vernon, 2527. In White Plains, 1,659. Even in some of our smaller communities, there's been a very heavy concentration. Portchester has 165 active cases on a base of 1,091 people who've tested positive. And the village of Ossining has 115 active cases on a basis of 975. And in some of our smaller communities, in Poundridge, we have 1 active case. In the village of Buchanan, we have 4 active cases. The active case metric, we think, is an important metric to use. Those are the people who we believe are still potentially subject to contagious spread of the virus. And this is all about reducing the spread of the virus so the least number of people get sick and the least number of people get ill, and obviously the least number of people are fatal. In addition to the general update on those statistics, we are in now the 2nd week of our efforts to test for antibodies. We formed a coalition, a partnership with Westchester Medical Center, and they are providing antibody testings. We've started out with first responders at the county government, the local government level, and those tests are being applied at the Westchester County Center, which now for the last few months has been turned over to the state of New York to serve as a medical facility. Those tests, as they're being taken there, have now, by the end of today, we think tested 2,000 people for antibodies, which is a very strong number. We started out a week ago today with 182 tests in that day, and we think today we're going to break 450 tests, which will be the highest per day number of testing. And that is a very positive sight. Northern Westchester Hospital will open antibody testing tomorrow on Tuesday in 2 locations, in their Mount Kisco facility and also their facility in Chappaqua Crossing. And that will be focused also beginning on first responders from that area of the county. So we think that over the course of the next number of days, we're going to be able to do quite a bit of antibody testing and in 2 different locations in the county. There are other sites where that's made possible as well. And of course, Westchester County, there are a number of COVID testing locations besides the Glen Island lot, which we set aside from the county, and Westchester Medical Center. And we've talked about some of the local sites. Governor's announced a number of different churches around the New York metropolitan area. One of them is Grace Baptist Church on South 6th Avenue in Mount Vernon. That's been opened up as well for that, will be opened up for that purpose. So we think that the testing module is very important as we continue on. We're going to come back to metrics necessary for opening. Just want to go over a few other things that are current. The county has been responsible for obtaining personal protective equipment, PPE, for all of the various municipal governments and some of the other entities within the county, hospitals, nursing homes, and so forth. And in that process, we've received a tremendous donation from a wide variety of organizations of masks and other types of material that can be then redistributed to the people across Westchester County. We've mentioned that a group of Chinese American citizens through their organization made a major donation a few weeks ago. Hanes Brands, which produces underwear products, made a tremendous donation, 300,000 masks for Westchester County purposes. We've also noted that the Greater New York Automotive Dealers Association made a major contribution of masks. And now we have a major donation of surgical masks to Westchester County Department of Corrections from WellPath, the organization that provides medical services for the county corrections facility. And that's to help reduce the spread of COVID-19 inside the Westchester County Jail. And that, again, is a very generous donation by WellPath. As we have received these, we have made an effort to circulate them out of the community. You may recall 2 weeks ago, we made an effort in a number of different locations. So to publicly make a distribution of masks in Ossining, in Peekskill, in Pleasantville, in Valhalla. We also were down on the Sound Shore in Port Chester and Mamaroneck and Larchmont for those distributions. And then last week, we went to the Theodore Young Center in Greenburgh, where we were able to give masks out to 3 of the major religious institutions in the Fairview section of Greenburgh, which targets the African-American community, which is one of the demographic groups that have been hit very hard by COVID in our county. And with the hope that when we share those kinds of products, masks and so forth, we're not making a political statement. We're trying to make a public health statement that you reduce the potential for sharing the infection between one individual to another if you wear a mask. If I put a mask on, it protects you from what I might discharge, and the same would be true if you wear the mask. And I think it's important to understand that these are public health advisories and requirements designed to help us reduce the spread of this contagion. If the contagion does not spread, if people do not get infected and they do not die, then we can begin the process of resuming the life that we've had. So the mask donations is very important, and we think very helpful, and we're going to be happy to do that in more cases as we go forward. We expect to be donating them to other church organizations and other organizations that are not religious in affiliation, but will serve a community need, and to do so would be helpful. And we thank the generosity of the donors, and we look forward to getting them to the hands of the recipients that need them the most. We do want to highlight again what we highlighted last week. We've established at the Nature Preserve at Lenoir in Yonkers, which overlooks the Hudson River, a Ribbons of Remembrance Grove, where we invite people at any time that the park is open during daylight hours. It's a dawn to dusk facility, to come down, and they go around the rear part of the Whiteman Mansion and look out across the meadow to the Hudson River. And they'll see an area there where you can take a purple ribbon out, make a notation on it for a loved one, hang it on one of the tree limbs or on a little bracket that's been created for these ribbons. It is a tangible way to say how much we love the people that we've lost. And it cannot be underestimated that when we talk about the dealings with this issue, we must talk about what do we have to do to reduce the spread? What's the public health side of this? What is the economic impact of this? And how do we intend to handle that economic impact? How do we intend to systematically reopen Westchester and New York State in a positive light? But if we fail to forget the fact that this This pandemic is about the loss of human life, then we miss the main event of it completely. It's cruel. It's heartless to not mention the names and the lives of those people that we've lost. That is really what this story is about more than any other single thing. And we certainly in Westchester take that message to heart. These are our neighbors and our friends, they're our relatives, and we've lost them, but we don't want to ever forget them. And the ribbons of remembrance at Lenoir Preserve serves that purpose. We hope you'll stop by, and whether you put a ribbon on a tree in remembrance of someone or just sit and contemplate this unbelievable experience we're going through. I don't think any of us will forget this experience for the rest of our natural lives. And for those of you who are very younger, when you're much, much older, you'll think back on what it was like in the spring and the summer of 2020 as you went through this great pandemic hit. We hope that we'll be through this in a reasonable amount of time. We'll be able to go forward in a productive and a positive way. The governor has laid out some very specific metrics for reopening. We're going to touch on them today. We're going to touch on them more in the days to come. But I just want to re-highlight some of these different issues quickly. The governor has laid out a game plan by region, and the region that Westchester County is in is the Mid-Hudson Valley region, the Lower Hudson Valley region, call it whatever you'd like. We are linked to Rockland, to Putnam, Dutchess, Orange, Ulster County, Sullivan County, and the general result in all of those counties together is what we're looking for in order to have a positive effect. Now, some counties might be able to meet this goal sooner than others, but it would be foolish to operate on a county by county basis because people live in one county and work in another county. People travel to school from one place to another. Their professional resources, the doctors they see or what have you, we're in one county versus the other. Across the dotted lines in northern Westchester, you can reach both Dutchess, Putnam, and Orange County very easily. And in the course of my business career, I've various times had to commute through Rockland to northern New Jersey as a matter of course every day. So to look at a singular county, I think is a narrow view. In certain ways, it's a selfish view. And we certainly are not selfish here in Westchester County. We have taken one of our great assets, the county center, and turned it into a temporary hospital with hospital beds. Nobody has to show their a card with their address on it if they need to check into that facility to be given medical assistance. No one cares if you're from Dutchess County or Rockland County or Orange County. You're a human being, you're a neighbor, you're a friend, and you receive help here in Westchester County. And we don't put up those barriers, and therefore we operate as a region, and hopefully we'll succeed as a region. The metrics that have been laid out have been as follows: that the region that we're in must show a 14-day decline in hospitalizations over the course of a 3-day average, so that there's a steady drop in the number of people that are being hospitalized, that there's a 14-day decline in the number of deaths overnight. Obviously, deaths, the number accumulates, but what the rate of fatality is has to decline over 14 days over a rolling 3-day average. And a rolling 3-day average means that for day Monday, you take into account the results of Saturday night, Sunday night, Monday night, and the average is today's number. Tomorrow's number will be an average of Sunday, Monday, and Tuesday. And you do that in order to avoid any spikes that might happen in a particular day. Where one day spikes up, the rolling average flattens it out a little bit, makes it a more representative set of numbers as to how you can judge by. So 14-day decline in hospitalized death. There's also a threshold for new hospitalizations, that there'd be under 2 per 100,000 residents. For Westchester County, a county of 1 million people, that means under 20 new hospitalizations in a given day. And that's a tough standard for the county to reach. And it couples itself with the other counties of the region as well. So the number may be a bit different. That we have to have at least 30% of all of our hospital beds available for patient occupancy if necessary. That is a threshold we have reached and can continue to reach it. A share of ICU, intensive care unit beds available, also at the threshold of 30%. We believe we have accomplished that number as well. That there be a testing of 30 people per 1,000 residents. Well, we have 1 million people. That means 30,000 tests a month. We're well over that number. I just announced that today, in the middle of our third month, we're at 112,000 tests. So we've averaged over 50,000 tests a month. This requirement equates to 30,000 tests in a month. So we've been able to do that. And then the one test that we're in the process of trying to satisfy now is putting together 30 contact tracers per 1,000 residents, therefore 300 individuals in Westchester County, to help us track down the current infection levels and trace back the individuals who have been interacting with those that have tested positive to try to help further contain the contagion. When we meet those thresholds, as soon as we can meet those thresholds, the governor has laid out a 4-phase reopening of that region. The first phase of it will open up manufacturing, construction, curbside retail. The second phase opens up all retail, finance, real estate, administrative services, insurance, and so forth. The third level of phase is opening up our restaurants and our bars and our other public accommodations. And the fourth one deals with education, arts, entertainment, some of the major facilities that we all go to for special events and activities. And in each one of these cases, there's a period of time between phase 1 to phase 2 where we have to maintain these reductions in order to qualify for the next level of opening. So as we look back on these numbers, our team is working very closely to try to achieve these different goals. Some of them we have solidly achieved, the testing area, the available hospital beds. We're putting the contact tracers into effect now. We monitor nightly the hospitalization rate and the fatality rate, and we look positively on some of the numbers so far, but the calculations have to be over 14 days, and so therefore we have to be sure that this is a continual trend and not just a short-term trend. And we believe that that is the case, but we have to go through these 14 days. So when people say, when are we going to open up Westchester? This is the path that gets us there. This is like, when you're driving your kids in the car and they're little and they say, Daddy, when are we going to get there? How soon are we going to be there? You know, when you look at the mileage signs, how many miles it is to your destination. Your kids don't know, and they're anxious, and we're all anxious. We all want to get to the destination. We all want to have that moment of satisfaction. We know we need to reopen the economy. We know we need to get back, not just on an economic path, but a path of sanity and normalcy for all of us as individuals. Every one of our lives have been changed by this, and dramatically. But the lives that have been changed the most by this are the lives of the people that have lost a loved one. There's a woman out there now who lost her husband and didn't expect to lose him at this stage of the game. Her life has changed more than your life and my life is. And so I think we have to put things in proper perspective. The proper perspective is we meet these deadlines, not because a governor establishes them, but because it shows that we're getting on top of the contagion as much as we can. The hospitalizations, the fatality rate, the amount of testing, the amount of available beds, having people out there to contact trace, all of these things being in place is a good thing that tells us we're responding to this contagion in an intelligent, reasonable way. The numbers I've said to you already shows a decrease in that over the last month. We're encouraged by that, but we're also not made cocky by this. If anything has come out of this whole experience, I think it's the fact that our society, this world, has been humbled. We have been brought to understand that we are talented humans on this planet. We're capable of many great things. We have intelligence and we have fortitude, but we are not omnipotent. And when a virus that we can't see, that we can't touch, starts to spread, and it's in Brazil, and it's in Germany, and it's in Singapore, and it's in suburban New York City, that is a moment for us to stop, take stock of things, and understand that there are things that are greater than us. We can respond to this. We will respond to this, but we don't respond to this out of arrogance. We don't respond to this out of swagger. We don't use this as an opportunity to continue to work the divides between people. We are all in this together. And together, we're going to get through this. We're going to get through each of these different standards. We're going to work hard to do it. And then when it gets to the business community, they're going to have to show plans about how they're going to socially distance when they operate their business. How are they going to handle the sanitization of their public and private surfaces? How are they going to make sure that their workforce stays healthy? These are challenges for the business community, or for any entity that operates in this world, not just corporate life, big business, small business, not-for-profits, governments, religious institutions, the whole gamut of them. But this is the challenge that we face. And we either face the challenge or we resort to, the kind of complaining that, frankly, that children do when they don't get their way. We're grown-ups. We know what we have to do. Now we have to do it. So we're going to open it up to questions. Do you have any questions, Catherine, from the members of the press?
So a lot of members of the press asked the same question. So I'm just
Yes,
going to group
sure.
them together, and you touched on some of it already. The first question, how close is the county to reaching the initial benchmark set by the state to reopen?
Well, again, these are regional benchmarks. What we don't know is how the other counties in the region are doing against this goal. We can make guesstimates of how we think they're doing, but I think right now we're fairly close to meeting these goals. I can't say that we can achieve all of them in a week because these 14-day statistics require so many days to pass. And we'll have to get some clarification of what we do with a particular spike that we may have had in one issue or another that would throw off our metrics. But in the 14-day declines, we think we're in pretty good shape. As I mentioned already, I think we're showing complete ability to meet the testing goals. We're showing complete ability to make the hospitalization available goals. We're doing what we have to get the contact tracers in place. I would like to think that by the end of the week, we could show significant progress in all of these different areas. And if we haven't met every single goal, we'll be on the cusp of having met every goal by the end of the week, perhaps by a week from today. Because again, we are part of a region. I think we're going to start to see statistics from the state that will take our numbers, which we'll continue to report on, and blend them in with the numbers from the other counties within the region, and we'll see how that works. But as I've said, I think we're close, but we're not there yet, and we have work to do, and that's what we're going to try to do. We're going to try to get our work done so that by the end of the week, beginning of next week at the latest, we'll be able to report to the state, we've met the goals that you've set for us. Now, how do we move forward from there?
Okay, next question, same topic. The governor is essentially saying regions will determine whether or not to dial back on reopening when it begins. What will be the indicators for you personally?
Well, the dialing back after we reopening is going to really be a direct proportion to any spike that we have in hospitalizations. What I've observed by the growth of infections, the number of people that test positive, is that the number of positive cases as it rises is not necessarily the most critical thing to look at. That's all we were looking at in the first couple of weeks. We had 40 cases, we went to 140 cases. Now it's how many people clear the bar of being healthy after 2 weeks and how many need hospitalization or not. So the hospitalization metrics in here really is what matters. There are cases of people who have not gone into the hospital and they have suffered fatality directly from trying to fight this off at home. But the vast majority of our deaths have come from people that have been hospitalized and were not able to rally for one reason or another. So I think the hospitalization statistic is the key statistic. And as we watch that statistic, that will tell us whether we have to dial it back or not. If we start to see, as we open up different types of things, a big spike, then we're going to have to step back and ratchet it back. In the first phase of opening businesses, when you talk about opening construction, manufacturing, and curbside retail, I don't personally think there's a tremendous amount of jeopardy in getting those parts of the economy going. It's the same judgment I made on recreation in the county. There's some things that we can't do. There's some things we can do. We're going to do the things we can do. I think it'll start to become more apparent when we have more clearly public facilities. When you begin to open restaurants, when you begin to have public gatherings back again, when churches and synagogues reopen, and assuming that we don't cap the number of people at a certain time that can be in a religious service and space them out and so forth, that's when we're going to be watching very closely to see if the infection rate jumps, because that's when you have a more broad public connection. And there's one other thing to say too about this. Because you open up a facility does not mean that people will patronize it to the same degree they did before. The example I've used, most of my friends know I'm a pretty big sports fan. And, I'd love on an available night to go out to watch a baseball game in person. I don't think you're going to see as many sellouts in Major League Baseball if the season resumes or starts up. I don't think if they finish off the hockey and the basketball seasons, I don't think you're going to get the same attendance. There's a pent-up demand to do that which you didn't do, but then there's also a fear that you don't know if you're going to be safe in the long run. Some people will override that and some people won't. As a person who spent his career prior to this in marketing and sales, trying to get people to buy a service or a product, some people won't come back into the marketplace until they know that they can be safe. When do they know they can be safe? They know they can be safe when there's a vaccine and when there's an antiviral treatment. But we don't have those things here. And I'm not one to go chasing after every potential miracle cure that somebody talks about. I'm not a scientist nor a medical professional, so I don't immediately assume that somebody says, X or watts of something, if you take that, it's going to be fine. I'm confident that when the scientific community finds what the cure for this disease is or what the vaccine is for this disease, it'll be known by everybody, it'll pass all the various tests, and it'll be in common use by all. But until that day happens, the consumer will decide for themselves whether they feel safe in an environment or not. Our job is to make sure that we try to manage the public face of these things effectively, open back up the society, and then for the businesses and the not-for-profit groups and the clergy and the other entities, for them to restructure the way the business functions to reduce the amount of spread. If we can reduce the amount of spread once the society is back open, then I think we're in shape. I mean, it's obvious I need a haircut. Now I'm multiple weeks beyond my last haircut. Frankly, I'm very happy at 66 to have some hair. But when I go to my barbershop the next time, I expect he'll have a surgical mask on and he'll have his hands in gloves, something that I didn't experience the last time I got a haircut. His business will function differently, but it will function. And that is really what will have to happen for these things to all fit into place. I am optimistic, but I'm also realistic. And I'm concerned that we don't have more people having to take ribbons to the ribbons of remembrance, because that is what this is all about. It's about saving lives. So we save lives, we open up the economy, we show discipline and a structure to the way we operate. That's how we get through this.
A bunch of questions from Low HUD. First one, cities like New Rochelle and Yonkers are breaking down cases by zip code now to identify hotspots. How critical do you believe that is for larger municipalities to do?
I think it's helpful. And I think what happens is that wherever you have a larger population municipality, you have areas of concentrated population and areas of light population. If you look at New Rochelle or White Plains as similar type communities, everyone knows zip code 10801 is the heart of town. In New Rochelle, 10601 is the heart of White Plains. More apartment buildings there. 10805 in the south end of New Rochelle, a lot of apartment buildings. 10804, the north end of New Rochelle, single family houses, more sparsely populated. White Plains, the same situation. 10601 in the heart of town. 10605, the southern part of White Plains, more residential communities. Knowing the number of cases, and sometimes knowing if they track to an apartment building or a particular complex, helps you fight that situation. What would you say? If you saw that there were multiple number of cases in a particular apartment building, then you'd put together a more aggressive sanitizing program in that building to make sure that every time you press an elevator button, go to your mail, take the latch off the front door to get into the lobby, that the sanitation was there so you wouldn't spread the virus that way. And communities that have that kind of diversity in housing stock can tackle those types of things.
Next question, also from Low HUD. Is the plan to still open with the rest of the Mid-Hudson? What if other counties like Dutchess or Putnam hit benchmarks sooner than Westchester?
I think that's up to the state to decide. If they decide that somehow they're going to break a region and let some of it go and work on the rest of it, that's entirely the decision of the state. My job is to make sure that Westchester hits the marks. If we hit the marks and we're in a position ready to be open, then we're going to tell the state we've done our job, we're ready to go. The businesses of Westchester County are ready to go, but we have in place the protections necessary, as well as we're ready to go. The desire to move forward is one thing, but to have the proper scientific medical protections is another thing. And the state will decide what happens if and when counties A, B, and C are good, but counties D, E, and F are not good. I think, however, there's sort of a perception, and the perception is because we're the largest county in the region that somehow we're the problem. I think we got hit first, long before the other counties did. And we have started to resolve those problems long before some of the other counties did. So as far as I'm concerned, we're making progress. We have to make more progress. The virus will tell us whether we're making progress or not. And if the state decides to do something different with the breakdown of the regions, that's their prerogative. We just are going to be ready for Westchester to be properly ready to reopen.
Okay. And the last question we have from News 12, is there any new information about the death of the boy at Maria Prairie Children's Hospital that was revealed on Friday?
Yeah, I've got no further information. To be candid with you, the information, once you get beyond a very surface level of it, is really private and not necessarily for general public discussion. The medical professionals, as they look at the case of this particular boy and the others in Westchester that are being treated for this disease, I understand there's another, I think 10 or 11 other individuals as of the weekend that are being treated for this. They're going to look for things that will tell us that which we can talk publicly about, which would be any general threat that that this disease represents for other children. But the family that had this tragedy happen to them is no doubt suffering greatly right now, and we don't want to add to that by asking 10 questions about a host of different things that might fit into the case as well. So I think we're out of questions at that point. If any of the members of the press want to talk with us thereafter, they can feel free to give Catherine Chaffee a call, our Director of Communications, and we're happy to talk to them one-on-one. We're trying certainly to get as much information from the state as we can, and to share that information as openly and as transparently as we receive it. We will be back tomorrow morning. Ken Jenkins will have the 11 o'clock Facebook Live interview with Dr. Damia Harris Madden, who's head of our Youth Bureau. If you want to go online and spend about 20 minutes of your time. Earlier today, I interviewed Sean Mead, who is the general manager of the Cambria Hotel in White Plains and also head of the Westchester Hotel Association. And we talk about the economic impact of the virus on the hotel industry and related industries. So a little bit of information in the Facebook Live interviews that give you a little depth as to the things we're dealing with. And then this session, hopefully, we try to make it as fact-filled as possible. In the meantime, stay safe, and we'll see you tomorrow. And hopefully we'll be through this and be able to celebrate. We won't be able to celebrate Memorial Day the traditional way. So make sure that you send your positive vibes to all the veterans in your world. 2 weeks from today will be Memorial Day. The parades won't happen, but our love for our veterans will still be there. Have a good day. I'm George Latimer.